I've been around Medicare a long, long time, and I think it's super important in retirement for folks to understand their options, how Medicare works. We've run into people all the time that make bad decisions on, you know, taking Part B, not taking Part B, maybe selling off some qualified funds, not realizing it could affect Medicare. Well, let's start with Medicare A, B, and C. We have a short time on this show, but I want to kind of simplify Medicare because I think too many people complicate it. And I like the way David brings it up to our clients. What is the important parts of Medicare? Well, really, Medicare is the federal health insurance program for people age 65 or older in America. As long as they've worked enough quarters, they can get Part A at no cost because they pay through their payroll taxes. So Part A, which is the hospitalization. So when somebody's overnight in the hospital and they're on Medicare, it falls under what's called Medicare Part A. Now, that is original Medicare. It's been around, like I said, the 3 decades I've been doing this. And then we're going to talk about original Medicare first. Then we're going to jump into some of the other different types of Medicare plans. But going back to Part A, that is your hospitalization. If you work enough quarters or your spouse do, then you get Part A at no cost. Now, Part B is a little bit different. Part B has a premium associated with it. And I know we're going to talk about the premiums later on. But Part B is everything outpatient that falls under outpatient surgery. If you're seeing a doctor at his doctor's office, that's under Part B. Part A, you have to be admitted in the hospital for it to be billed under original Medicare Part A. So really you have Part A and B, and they've been around, like I said, for 30 some years, since the 60s when it came out. But basically Medicare, the important thing is to realize Medicare does not cover all your healthcare expenses. There's gaps to Medicare. And when you look at Part A and Part B, which is called original Medicare, typically our clients in retirement are looking to cover those gaps. The last thing you want to do is go in and have a surgery or a major operation and have a $50,000, $60,000, $70,000 bill in retirement. So that could really hurt somebody. So typically people say, well, how do I cover the gaps? Now there's several ways to cover the gaps. I'm going to kind of follow along with the alphabet here. If you go from A to B and you go into C, Part C stands for Medicare Advantage plans. So it's a little bit different than being on original Medicare, but Part C is a way to cover the gaps in Medicare. I think the important thing, like I said earlier, is looking at these gaps. How do we cover them? What choice should I make? And really it depends on planning for your healthcare and what you want your healthcare pipeline or healthcare future, healthcare retirement to look like, because there are very different ways to cover those gaps. Original Medicare with a Medicare supplement has additional premiums. It's private insurance. It follows A and B. So if there's gaps in A and B, then you pick up a supplement to cover those gaps. But if Medicare doesn't pay, the supplement doesn't pay. So it's very important people understand that, if you want to go get Botox or, some, experimental surgery and Medicare doesn't cover it, the Medicare supplement's not going to cover it as well. When you go to Part C, which is called Medicare Advantage, that is a little bit different. Part C, you pick a company and you partner with that company for 12 months, January 1 to the end of the year. And Part C says, okay, we're going to take the funds from Medicare. We're going to design this plan. It's a private plan. And whatever the company is, they're going to determine what your co-pays and cost share are. And it's all has to be approved by Medicare. So I think what people don't understand is, Part C, those companies can do whatever they want. No, they're regulated by Medicare. So they're just two different ways to cover the gaps.
Yeah. And Steve even said this earlier, and I'm glad you did, Steve. I make it a lot more simple. I mean, I don't do a ton of Medicare, especially with my clients, but just because I have agents under me, of course, that help out with that. But we do think I bring it up to every client because it is a big part of the retirement plan, right? Financials, when a client meets me, I always touch on the Medicare first, because you need to understand, hey, look, what plans are you on? How is that affecting your Part B premium, which we're going to go over later. But, one of the biggest things that a lot of times I hear, I don't pay your Medicare. And I'm like, yes, you do. You do. I mean, a lot of my clients obviously have an income. Now, the Medicaid state program obviously covers, right, a lot of those Medicare expenses if you're lower than that threshold of income. But, majority of it is on Medicaid, they're on care. Okay. So what happens is that Part B premium has that IRMA chart, which we're going to talk about soon. But income affects that. So one big thing that I always tell clients is listen, go ahead, Steve.
Well, good point. I was, one of the things I talked about earlier was Part A has no premium as long as you paid enough taxes throughout. It's 40 quarters throughout your working life, or you can collect off your spouse or working partner. So you don't have to pay for Part A, but Part B does have a core premium. And basically what that means is whoever's on Part B of Medicare, which is part of the original Medicare, that's outpatient services, there has to be a premium that's paid back to Medicare for that Part B insurance. Now, like you said, a lot of people say, well, it's free, I don't pay that, or I'm not paying a core premium, which pertains to their income, which I'll let you get into more later. But I think it's important to realize that there is a premium associated with Medicare, and that premium dollars is what buys you the outpatient coverage. And typically it's drawn from Social Security checks. So sometimes people don't even realize they're paying it. It just automatically comes out of Social Security for Part B.